Hey, what is happening, folks? I am flying solo today. And the reason is I've got a video that I'm going to share with you guys. We're going to look at it and we're going to skim through parts of it. But it's from Bloomberg and it's about how gun violence is a public health crisis. That's right, ladies and gentlemen. The same people who managed to completely screw up the response to the coup we had not that long ago. Uh, they think they can take on gun violence. Yeah. And of course, they really start off with a lot of misinformation, a lot of disinformation. And it's really, really kind of pathetic. So we're going to watch this. It's going to be on one side of your screen. We'll watch this together.
This is not meant to be sensational, right? There's no need for us to sensationalize any data. But the truth of the matter is, for the last 2 to 3 years now, guns have been the leading cause of death among kids.
Yeah. It hadn't. Let's understand that it's not that he's just making this up out of whole cloth. There is a study that supports his supposition. What he's saying, absolutely. But there's a problem with that study. See, that study is everyone from the age of, between the ages of 1 and 20. Basically, anyone 1 year old or older up until 19 years, 364 days. They count them all as children. A third of those gun fatalities, and again, we're talking about suicides, homicides, etc. A third of those are people ages 18 to 19. Now, in no way does our society consider these people children, at least within the eyes of the law. Yeah, the older you get, it's hard not to look at a 19-year-old and go, you're a kid. But we have stratus, we've laid out markers. At 18, you're able to make decisions for yourself. You're no longer under the control of your parents. You can do a lot of things without having to get their permission. And that includes criminal activity. That's right. That's where a lot of these come from. They are involved in criminal activity. And a lot of them aren't, don't get me wrong, but sometimes they are involved in cultures. They interact with cultures that are criminal in nature and criminal in outlook. And it results in a higher number of fatalities. Also, 18, 19-year-olds, a lot of these guys are starting college. Suddenly, life's a lot harder. They're away from home. Their girlfriend may have broken up with them because of distance. It can lead to some unpleasant self-harm. Let's just put it that way. So, that's a big deal. When you take out that 1/3, though, what you also end up with is, you end up with a case of the total number of gun fatalities being lower than, say, car accidents. Funny how that doesn't make it in there, isn't it? All right, let's go back. Let's go back to the video.
Physicians are treaters of the sick and preservers of the healthy. So there really is nothing else that a group of physicians would rally behind other than saving lives.
And I don't have a problem with that idea. Healthcare professionals should want to save lives. That's otherwise you shouldn't be in the job. The problem is that because this is Bloomberg, we know where this is going to go, and it is the idea that gun control is how you save lives. We'll get into that in a little bit, but I'm not buying it.
This epidemic is uniquely American.
It's not. I mean, yeah, we have higher gun fatalities, but it's just because it's American. It doesn't mean it has anything to do with firearms, because our non-gun homicide rate is higher than a lot of other countries' total homicide rate. And you're a freaking idiot if you think if you just removing the guns, none of those gun homicides would, be taken, would happen with a different weapon. Just done.
Gun violence is a public health issue and a healthcare issue.
Is it? See, this is argument by assertion. I'm a doctor. I say it's a public healthcare crisis, so public healthcare issue. So you need to listen to me. No, you don't actually make the point. In fact, they're just going to assume it is and expect you to accept it. That's not how things work. You can't just declare something a public health crisis and it be a public health crisis. But let's let's let him go on a little bit more.
This is not Democratic or Republican. This is just protecting humans.
Sometimes.
Okay, it's just protecting humans. Guns protect humans. I hate to break it to you, lady, but guns protect humans. They also protect animals, livestock, et cetera, et cetera. But at the end of the day, guns protect humans, right? Removing guns doesn't protect humans. It simply makes a lot of humans more tempting prey for the predators.
Sometimes you have to lose. Sometimes you have to push a boulder up a hill and it has to crash back down on you, but you won't succeed without ever trying.
America supports all these bills. And it needs to be the time now where the politicians realize that if government doesn't back us, that they're going to be voted out. Exactly.
Just point here. No, they don't. What happens is when polling takes place, they ask some questions, and it's, do you support universal background checks? Seems pretty straightforward. But the problem is people say, yeah, or actually what happens, they ask if, do you support background checks on all gun purchases? A lot of people assume, just assume that this is what we're talking about, that we're talking about universal, or what we already have, I should say. That when you go to buy a gun at a gun store, you get get a background check and all as well. What they don't tend to support nearly as much is finding out that even loaning a gun to a friend should require a background check. If you your child is to inherit your guns when you pass away, they should have to undergo a background check. Things like that are not nearly as popular. That's why it can poll sky high in, say, Maine, where it polled really well, went on the ballot for the voters of Maine to support, and they voted it down. And it's happened a lot of other places. Why? Because when the rubber meets the road, the idea isn't as grand. Polling data is just a snippet of an idea. It does not necessarily reflect support for given legislation.
We have seen that when we take public health approaches, that we save lives. Motor vehicle accidents are no longer the #1 cause of death of children because of safer cars and car seats.
Going back to what I said earlier, they're still the #1 killer of kids when you account for legal adults not counting as children. But let's compare. Cars are safer than they used to be, no doubt. Having kids in car seats, much safer than keep holding the kid in your lap. Absolutely. All of these things were public health initiatives that worked really well. The difference is guns don't just kill on their own, okay? A car killed because of a situation no one intended to happen, but happened anyways, okay? Cigarettes were a completely different animal. That was where the tobacco companies apparently hid the dangers from people so they couldn't make informed choices. These are all very, very different things from the willful act of a third party. Okay. You can follow every guideline about guns you want to name, including one they get into later saying the best course is just not have a gun. The truth of the matter is that you can do that and you still can get killed because this is depending on a third party's actions. And it's a willful action. It's not negligence that results in most of these. Are there negligence? Is there negligence with firearms? Unfortunately. It really doesn't amount to nearly as many fatalities as a lot of people think. It's a very, very tiny, tiny fraction of the total number of gun fatalities. The vast majority are intentional acts. With homicides, you're dealing with the intentional act of a third party. With someone self-harming, YouTube gets wonky about some of the language, but when it comes to, say, self-harming yourself, and something like that, you take away the firearm, the option's still there. You're not solving the issue. You're just simply shifting it to somewhere else. And that's the public health initiatives of the past have no bearing on firearms because of that.
We can use that same public health approach to discuss guns and gun safety legislation and create meaningful change. How can we?
All right, no. See, it's not about discussing. What they want to do is they want to lecture us. They want to tell us straight out, hey, this is what you have to do. This is what you're gonna do. And if you don't do it, we're gonna, we're gonna do something. I'm sorry, but there's no discussion here. All right, these are our Second Amendment rights. Well-regulated militia being necessary to the security of a free state, the people's right to keep and bear arms shall not be infringed. The fact is, in every other place in the Constitution, the people refers to individual peoples. It doesn't refer to states or groups of people in formal militias or anything of that sort. Nowhere else does it mean that. And there's still the fact the people's right to keep and bear arms shall not be infringed. All right. So I'm sorry, but I don't care if you really think that this is a public health crisis and public health initiatives are needed. You don't have a leg to stand on.
We, as medical experts, help you guys. So what do you need? Do you need more doctors from your state that we can help provide you to provide evidence? Do you need us to come to hearings for you? We are here to collaborate with your office to whip these votes because we're sick of letting children die every day.
All right. Nobody is going to disagree with the idea of letting children die. We don't want children to die. I mean, that's encoded biologically in us, right? We protect children. That is the purpose of an adult. Why do we work? To protect our children. Why do we have homes? To keep our children safe. All of this exists for a reason, and we are biologically driven to protect our young. So I don't have a problem with that. But you know what I use to help protect my kids? They're called guns. That's right. I use firearms to protect children, to protect my children. Now, thank God I've never had to fire a weapon in self-defense. I am so glad I've never had to. But you take away my ability to, and how long before I end up getting to regret that change, that I am no longer able to protect my family. Gun control is not an automatic, this will keep everybody safer. No, what it does is keep some people potentially safer at the expense of others. When the low end estimates of defensive gun use is 500,000, the high end is somewhere around 2 million to 2.5 million. So let's call it, I think one of the more recent ones was 1.6 million. When you're looking at potentially millions of lives every year being protected by firearms, I'm sorry, you're not going to be able to convince me that restricting gun ownership is quote unquote gun safety legislation. And it's not about safety, it's about control. They simply are using a different name to sell it. But you're never going to be able to convince me that gun safety legislation is really going to make everybody safer. Okay, you're not. Could it potentially prevent a handful of cases? Well, yeah, probably, possibly. I can't say definitively that it won't. But I can look at all these defensive gun uses and say, I'm not entirely convinced that the overall balance sheet is going to come out favorably if you go with gun control.
A typical day is going from meeting to meeting, no breaks, lobbying all day, and presenting our statistics and data and research. I usually try to open and say, my name is Dr. Emily Lieberman. I'm a pediatrician, a wife, a mother. I am now also a mass shooting survivor. And I have the unfortunate but unique perspective of now being a survivor of gun violence.
She was President Highland Park. Okay. Let's not get too carried away here.
And also a pediatrician who treats people in the community who have suffered from gun violence. And I think that sets us apart from a lot of the other meetings.
At Bearing Arms, I work with a gentleman by the name of Ryan Petty. Ryan's daughter was killed in the Parkland massacre. He is a vehement Second Amendment supporter. So, he doesn't seem to get the press, though, that, say, Fred Gutenberg gets, or that David Hogg gets, or, the doctor here gets. Why? Why is it? Isn't he a survivor? Isn't he impacted? Not a survivor. Well, he survived his daughter, but we're getting into semantical arguments that are irrelevant. This doctor, yeah, she went through something pretty bad. Okay, I can only imagine what it was like being at Highland Park. I've been touched enough by mass shootings. I really don't want to have to go through one. But that doesn't really give anyone any authority. See, simply being at a given place at a given time does not somehow make you morally better than someone who wasn't. Okay. It doesn't impart any relevant expertise on what it's like to be in a situation like that. Her expertise is what it's like to have been president at Highland Park. That's it. And she's going to talk about it here in a minute. But, the truth of the matter is, this is kind of an argument from authority. I did this, therefore you should listen to me on something that's only tangentially related.
We live in Highland Park, which prior to July 4th of last year, I think anyone would say was probably one of the safest appearing communities in the country. We're kind of Pleasantville, for lack of a better word. On our nation's most patriotic day, July 4th, our family woke up, put on 4th of July attire, and met with cousins and my parents. Our children were in the streets, there was laughter, we're waving to politicians. And then all of a sudden, there is a horrible popping sound overhead. And it becomes clear very quickly that this is a gun.
7 people were killed and more than 48 others were injured after a gunman opened fire at a 4th of July parade in Highland Park, Illinois. According to the Gun Violence Archive, it was one of 647 mass shootings that took place in 2022.
Yeah. No, it's not. All right. Gun Violence Archive is, to put it bluntly, they lie with statistics. What they've done is they've used an extremely broad definition of mass shooting, and they have taken it to a situation where, all right, let me back up. Gun Violence Archive basically defines any mass shooting as any shooting with 4 or more people shot, if I remember correctly. Doesn't have to be killed. Now, when most people think mass shooting, they think at least 3 people killed, right? The FBI defines mass murder as, 3 people killed. I think it might be outside the home. Mass shooting is extrapolated from that. A lot of other places use 3 or more people killed outside of the home, sometimes 4 or more. These are the standard definitions. Gun Violence Archive swoops in, uses a different definition, which includes a lot of gang warfare, a lot of shootings that have nothing at all to do with the typical mass shooting, and then inflates the numbers to make mass shootings look like a more terrifying and everyday occurrence than they really are. They're not. Okay? They're not. And when you keep pushing these numbers, it's really hard to take you seriously. Yet the media and the gun control groups latch on to them. Of course, then again, media, gun control, I'm repeating myself. But they latch on to them and they push them. And a lot of people don't know the definitions. So they assume what they're thinking of a mass shooting is what we're actually seeing.
Unfortunately, we've learned that we can't keep our children safe when most of these weapons are on the streets. But what we can do is help prevent these shootings from continuing to occur, which is what we are here to do now for the rest of our life.
The vast majority of homicides are carried out with guns that are not purchased at a lawful gun store. Okay, it's not someone going through the background check, dropping the money, walking out with a firearm in accordance with all applicable laws. They are picked up at the scene, meaning someone maybe breaks into the house and finds your gun before you can get to it. They are stolen guns. They are obtained via the black market, right? Mass shootings are a little different, but again, mass shootings only account for a very, very small percentage of the total homicides. And let's be perfectly honest. There's only so much you can do to stop a mass shooting. Most shooters use handguns, which the Supreme Court has already said is a protected, or in common usage, I think is the preferred term. You're not going to just negate this. We're not by restricting guns. If you want to do something about preventing these kind of shootings, we need to start looking at how to get into the head of these people, figure out what screws are loose, and figure out how to tighten them.
You can see this is a pediatric surgery OR. And so typically when a patient rolls in, they're going to be lying down here. This is where the anesthesiologist is. And then once the patient is asleep, the whole team kind of functions, very much as a well-oiled machine. We've here on the front lines have felt that 350% increase in the number of kids with gun injuries last year here in New York.
Okay. You're starting to see how this is going to work. They wheel them into an OR, showing the place that, no kid should ever have to go. And there's there's a 350% increase in children being shot. This is somebody who's already used a number that counted 18 and 19-year-olds as children. So sorry if I don't actually buy his percentages. I'm not going to go through any more of this because, frankly, I can't stomach the BS. All right. It's absolute nonsense. And what's more is they are trying to paint a picture that they are good and righteous, which, in fairness, everybody's going to do. But at the end of the day, they're trying to restrict a basic human right. Just because other countries don't recognize that right doesn't negate the right. They want to restrict what you and I can have because of what they see in the OR, right? This doctor's talking about things that happen in the OR. What he doesn't see are the kids who aren't shot, okay? He doesn't see the kid whose life was defended because someone had a firearm. He doesn't see the animal maulings, the dog maulings, the mountain lion maulings, or, these kind of horrific incidents that, can kill, can scar, can maim young children because that don't happen because someone has a firearm. Right. At the end of the day, this is what we're getting from Bloomberg. And you can see there's a lot of manipulation. It's all about emotion. It's all about, let's give you part of the facts without getting into the nitty gritty. But the end of the day is the nitty gritty actually matters. Okay. Bloomberg is going to try to sell you on gun control. They're going to call it gun safety, but it's not. Right. Gun safety is safety. It is knowing how to handle a firearm appropriately. Later on in this, they also talk about how the American Academy of Pediatrics says that the best case scenario is just not to have a gun in the house. Again, at least 500,000 defensive gun uses. Some estimates show 5 times as many defensive gun uses. Right? All of those dwarf the incidents that happen with kids. Right? Look, if you have a kid, keep your weapon secured. Do not let them get to it and so they can mishandle it and potentially hurt themselves, or take it to school and hurt someone else. Right? Don't let that happen. But for whatever, for the love of God, do not listen to these doctors who try to pretend that they know what's best. I'm sorry. Telling me I need to cut down on my salt because my blood pressure is too high? Sure. Telling me I need to change my diet because I'm showing signs of diabetes? Sure. Telling me I have a tumor? Absolutely acceptable. All of these fall within their realms of expertise. Getting upset because you went through something horrible and now saying that, well, we should completely restrict people's right to keep and bear arms, that's outside your expertise. You don't have any business trying to tell people what they can and can't do.